लगाता हूँ। हाँ अभी तो चल रहा है सही, चलें ठीक है, करते हैं फिर स्टार्ट। सही नजर आ रही है आप सब लोगों को? हाँ ठीक है, ओके। तो देखें, कल हम लोग डिस्कस कर रहे थे कार्पल बोन्स वगैरह और वो सब कुछ, ठीक है। आज हम वहीं से उसको कंटिन्यू करते हैं और इसको करते हैं कंप्लीट वगैरह, ठीक है। तो ये देखें, कल हम ये डिस्कस कर रहे थे शोल्डर जॉइंट डिसलोकेशन वगैरह, रोटेटर कफ मसल्स। ओके, तो इसमें हमने यही बात की थी कि देखें रोटेटर कफ मसल्स में आपके कौन कौन से मसल हैं। आपके हैं सुप्रास्पाइनेटस, इंफ्रास्पाइनेटस, and then you have the teres minor, and then you have the subscapularis muscle. Okay, so because only here one muscle is attaching, so shoulder joint dislocation most common it is the anterior inferior dislocation. Okay, and very important MCQ. This is your MCQ which you must have to remember, that is known as the winging of the scapula. Okay, so please remember, winging of the scapula. Winging of the scapula, it is the most important MCQ which you all must have to remember. Okay, so this is the winging of the scapula, and you now you can see here that the medial border. Okay, this is the medial border of your scapula bone. Okay, so this is the medial border of the scapula bone. So this medial border of the scapula bone, see in what will happen whenever there is a lesion of long thoracic nerve. Okay, what will happen? There will be paralysis of the serratus anterior muscle. Okay, so serratus anterior muscle uh, is supplying या serratus anterior muscle की जो innervation है, that is your long thoracic nerve. Okay, and this serratus anterior muscle it is also known as the boxer's muscle. ठीक है, इसका दूसरा नाम है बॉक्सर्स मसल। तो सी इनएबिलिटी टू एंकर स्कैपुला टू द thoracic cage or cannot abduct the arm, because serratus anterior muscle it is also going to help you in abduction of the arm above 90 degree. Okay, तो देखें, initiation of the arm abduction by supraspinatus 15 to 90 degree it is the deltoid muscle, and from 90 to 180 degree it is the trapezius muscle and the serratus anterior muscle. Okay, so when this muscle is going to be damaged, what is going to happen? Patient will come to you with this. Okay, so this is the medial border of the scapula. This medial border of the scapula becomes prominent, and when it becomes prominent, it is known as what? Winging of scapula or wings of heaven. And which nerve is going to damage? The answer is your long thoracic nerve, which is also known as the nerve of the bell. Okay, so this winging of scapula, it is very, very important. Okay, so see here how this nerve can be damaged. This nerve can be damaged when axillary node dissection after mastectomy or in the stab wounds. Okay, but please remember, during axillary node dissection after mastectomy, the most common nerve, यहाँ पे एक MCQ है, the most common nerve which is going to damage during this axillary node dissection या एक्सिलरी नोड डायसेक्शन, उसका आंसर होगा intercostobrachial nerve. Okay, so this is also your MCQ, intercostobrachial nerve. So this is the most commonly nerve damage, but this nerve, long thoracic nerve, can also be damaged. So they can give you a scenario like this, that a female patient is having mastectomy is performed on the female patient, and the surgeons have performed axillary node dissection because of the involvement of the axillary node. Okay, and after the dissection, what is happened, that the medial border, this is the medial border of the scapula. The medial border of the scapula becomes prominent. So if they give you a scenario like this, it means that this is the lesion of your long thoracic nerve. So this is the lesion of your long thoracic nerve, which is also known as the nerve of Bell. Okay, so ये बहुत important MCQ है. You must have to remember. Okay. After coming this, now see here. Whenever you are performing shoulder abduction to whole will be the 180 degree. And when this whole 180 degree, see here, whole this 180 degree, the scapular rotation. Okay, so this is your scapula bone, so it is going to rotate laterally. So lateral rotation of scapula will only go up to 60 degree. But the elevation of the humerus bone, it will be 120 degree. Okay, so please remember that the ratio of the elevation of humerus to the lateral rotation of scapula, it will be 2:1. Okay, so both will help you in performing the shoulder abduction. Okay, और बाकी आप लोगों को वो MCQs you already know. Initiation of abduction, it is done by the supraspinatus muscle, 15 to 90 degree. It is the deltoid muscle, which is innervated by your axillary nerve. More than 90 degree up to 180 degree, it is the trapezius and the serratus anterior muscle. Okay. So see here, this is the shoulder abduction. When you are going to place your hand near the body, this is known as adduction. Okay. So this is shoulder abduction. Okay. Next important topic in upper limb, it is your clavipectoral fascia. So clavipectoral fascia, I will draw the diagram myself ताकि आप लोगों को उसको ज़्यादा easily और वो clearly समझ आ जाए. Now see here how you are going to draw the clavipectoral fascia now. Number 1 point. When I explain you about the breast, okay, तो मैंने बताया था breast के नीचे you have a muscle, okay, and the name of this muscle is your which one? This is your pectoralis major muscle. Okay, this is your pectoralis major muscle. This pectoralis major muscle, it is covered here by fascia, which I am drawing here in the red color. This is known as pectoral fascia, or it is also known as deep fascia. Okay, इसके ऊपर था आपका mammary gland. Okay, you remember? Above it is your mammary gland. Okay, deep fascia. So mammary gland, it is present in the superficial fascia. Then you have this pectoral fascia, which is covering your major muscle of the pectoral region, that is the pectoralis major muscle now. Okay, now see here. Now I am drawing here the clavicle bone. So this is your clavicle bone now. Clavicle bone. Okay, now under the clavicle bone here, you have this muscle present. This muscle is known as subclavius muscle. Okay, this is your subclavius muscle. And under here, there is one more muscle is present. That is your pectoralis minor muscle. Pectoralis minor muscle. Okay, subclavius muscle and pectoralis minor muscle. Now see here. What is clavipectoral fascia? Now we must have to know what is clavipectoral fascia and which structures are piercing the clavipectoral fascia. So see here, this is your clavipectoral fascia now. So this fascia is going downward like this. Now it is covering the subclavius muscle, and now it is covering your pectoralis minor muscle also. And now it is going downward, and now it is forming this ligament here. This is known as the suspensory ligament of axilla. Okay, this is known as what? Suspensory ligament of axilla. And now it is going to merge here with this fascia. This fascia is known as axillary fascia. Okay, this is your axillary fascia. So this is your clavipectoral fascia. So they can ask you the MCQ like this. Which two muscles are covered by the clavipectoral fascia? Your answer will be subclavius muscle. your answer will be pectoralis minor muscle. Okay. So pectoralis minor muscle and subclavius muscle both are covered by your this green color fascia, that is your clavipectoral fascia. Okay, this is your clavipectoral fascia. Okay, ये वाला. This is your clavipectoral fascia. Now see here. Now there are some structures which is piercing this clavipectoral fascia. Number one. Number one structure which is piercing the clavipectoral fascia, that is your cephalic vein. Okay, cephalic vein. Okay, so I can draw here diagram like this. See here. The cephalic vein is piercing the clavipectoral fascia and now it is draining into this vein. Because it is in the axillary region, so this vein will be your which vein? This will be your axillary vein. Okay. So cephalic vein is draining the blood into the axillary vein. So first is your cephalic vein. Second is your artery, which I am drawing here in the red color. This artery is your which artery? This is your thoracoacromion artery. Thoracoacromion artery. Okay. The blood supply I am going to explain to you, then I explain to you from where it is coming. Thoracoacromion artery. And this artery is also a branch of your which artery? This is a branch of your axillary artery. Okay. This is also piercing your clavipectoral fascia. And third structure which is piercing the clavipectoral fascia, that is your which one? That is your lateral pectoral nerve. Lateral pectoral nerve. Okay. And this lateral pectoral nerve, because its name is lateral, so it is coming out from where? From the lateral cord of brachial plexus. Lateral cord of your brachial plexus. Okay. So it is very easy to remember, and lymphatics are also piercing here. So these four structures are piercing your clavipectoral fascia. First is your cephalic vein. Second is your thoracoacromion artery. Third one, it is your lateral pectoral nerve. And fourth one is your some lymphatic, which is also piercing your clavipectoral fascia. It is clear to everyone. Okay. So see here now. Now we will see our diagram. See. So this is your clavipectoral fascia now. So it is covering here. It is covering here the subclavius muscle. It is covering here the clavipectoral fascia. And this is your known as suspensory ligament of axilla. And it is now merging with the axillary fascia. Okay. Now see here. Four structures are piercing the clavipectoral fascia. Number one, thoracoacromion artery, branch of your axillary artery. Second, cephalic vein, draining the blood into the axillary vein. Third, it is your lateral pectoral nerve, which is piercing the clavipectoral fascia and it is coming out from the lateral cord of the brachial plexus. Okay. So this is your clavipectoral fascia. It is clear to everyone. I hope it is clear to all of you. Okay. Now coming into this diagram now. Now see here, this is the muscles of the back. Now see here, one muscle which is covering here, the upper part of the back, it is known as the trapezius muscle. Second muscle which is covering the lower part of the back, it is your latissimus dorsi muscle. This is the lady. Okay. So this lady muscle fibers are inserting where? Please write down in the chat box. Latissimus dorsi muscle fibers are inserting where? Write down in the chat box. Everyone, hurry. अभी तक किसी ने नहीं लिखा. Floor of bicipital groove. Floor of bicipital groove. Okay. I explain you the mnemonic. Lady between two majors. Okay. Major which is on the medial lip, it is your teres major. Major on the lateral lip of the floor of the bicipital groove, it is your pectoralis major muscle. Pectoralis major muscle. Okay, so see here. Fibers of latissimus dorsi. These are your fibers of latissimus dorsi. Okay, these are your fibers of latissimus dorsi. And all are going now upward and now they are merging, inserting into the floor of the bicipital groove. Okay, and please remember this latissimus dorsi muscle, it is innervated by thoracodorsal nerve. Thoracodorsal nerve. Okay. Thoracodorsal nerve. Okay. Now see here everyone now. If I remove this trapezius muscle, trapezius, it is innervated by your accessory nerve, which is your 11th cranial nerve. Okay. Spinal part of the accessory nerve. Accessory nerve is innervating your two muscles, sternocleidomastoid muscle and your trapezius muscle. But accessory nerve, spinal part. Okay. Spinal part. So if I remove the trapezius muscle here, now this is the scapula bone now, which I am highlighting at the moment in red color. This is the spine of the scapula bone. Okay. So this border is your which border? This is your medial border. This border will be the lateral border. Now see here. On the medial border, you have levator scapula muscle. On the medial border, you have rhomboid minor muscle and rhomboid major muscle. Okay. So medial border, you have rhomboid minor and rhomboid major muscles. Okay. On the lateral border here, you have which muscles? Teres minor muscle and teres major muscle. Okay, teres minor and teres major muscle, they are fibers are originating from the lateral border of your scapula bone. And this is your, see here, this is your supraspinatus muscle. This will be your infraspinatus muscle. Okay, so see this diagram, everyone. This is the supraspinatus muscle. This is the infraspinatus muscle. Okay, and I explained to you that supraspinatus, infraspinatus, these are known as SIT muscles. All these three muscles are inserting where? Write down in the chat box. Write down in the chat box. SIT muscles are inserting where? Yes, very good. They are inserting on the greater tubercle of your what? Humerus bone. And you have one more muscle which is inserting on the lesser tubercle. What is the name of that muscle? Write down in the chat box. Write down in the chat box. Which muscle is inserting on the lesser tubercle? The lesser tuberosity. Yes, very good. That is your subscapularis muscle. Okay. All they are together forming your what? They are forming your rotator cuff muscles. Okay. And see here. Now tell me this muscle. One second. I zoom this muscle. Oh, किधर चला गया? 1 second. See here. Tell me what is the name of this muscle now? Write down in the chat box. This muscle. Very good. This is your teres major muscle. How you can identify? Because it is inserting in the floor of the bicipital groove. Okay, so this is your teres major muscle. And this muscle, which I am highlighting now, and now it is in inserting into the greater tubercle. This is your which muscle? teres minor muscle. Okay. So by just seeing the picture, you can easily explain that, sir, this is the teres major muscle. This is the teres minor. So both are on the lateral border of the scapula. This is the medial border. So on the medial border, you have rhomboid minor, rhomboid major, and this muscle, that is the levator scapula muscle. That is your which muscle? Levator scapula muscle. Okay. Now see one more thing here. Now in this diagram, now in this diagram, now see here everyone, all students. I remove something here. Now see this one. In this diagram, two triangles are forming. See here everyone. See, this is your number one triangle, which I highlight in the green color. This is known as triangle of auscultation. One triangle. Second, this triangle. This one. This is known as lumbar triangle. Lumbar triangle. Okay. Or it is also known as Pettit's triangle. Pettit's triangle. Okay. Now you must have to know the borders of these triangles now. Okay. Now see here. This is your which muscle? Now you can easily write yourself the borders. Trapezius muscle. Okay. Trapezius muscle. This is your which muscle? Latissimus dorsi muscle. Okay. And this one. This is your what? This is your triangle formed by the border of your scapula bone. Okay. So this part is not completely covered by the muscle. So this is known as triangle of auscultation. Okay. This is your what? Triangle of auscultation. Now see, this is the lumbar triangle or Pettit's triangle. What are the borders? See here, this is your latissimus dorsi muscle. This is your iliac crest. And this is your external oblique muscle. So this is the boundaries of your what? Of your lumbar triangle, or also known as what? Pettit's triangle. Clear to everyone? Okay. So the from lumbar triangle, hernia can protrude out. This triangle of auscultation you can use for what? For auscultating the lungs. Okay. This is clear to everyone. So see this diagram now. See, this is the triangle of auscultation. Trapezius muscle, the latissimus dorsi muscle, and your border of the scapula. Which border? That is your medial border. So it is forming here what? Triangle of auscultation. Okay. And then see here this triangle, which is formed here by the iliac crest, the external oblique muscle, and the latissimus dorsi muscle. This is also known as the Pettit's triangle. Okay. So hernia can come out from here. This is known as your lumbar hernia. Okay. So these are the important clinical correlations to these triangles. Okay. So these are your important points which you must have to remember. Now one more thing which I want you to explain. Now see this one. Now tell me you all students now. This is which border of the scapula bone? This is the which border of scapula bone? This is the medial border of scapula bone. Okay. See here. This is the lateral border of scapula bone. Lateral border of scapula bone. Now see here. These muscle fibers which are inserting here. This is your teres minor muscle. Okay, teres minor muscle. These fibers which are inserting into the bicipital groove or floor of the bicipital groove, this is known as your what? This is your teres major muscle. Okay, now see here. This is your glenoid cavity now. Glenoid cavity. Okay, and this is the infraglenoid tubercle. Infraglenoid tubercle. Okay, and see here from infraglenoid tubercle, your long head of triceps is coming out. Okay, long head of triceps, it is coming out from where? From infraglenoid tubercle. Okay, infraglenoid tubercle. Now see here, when this triceps is going here, it is forming here one quadrangular space. It is forming here this triangular space and this triangular space. Now these quadrangular space and triangular space is very important now. Okay. So we will draw this diagram ourselves now. Okay. इसको हम खुद बनाते हैं. Now see here everyone. ये पता नहीं क्या बन गया. स्कैपुला बोन. ठीक है. ये स्कैपुला बोन हमारी थोड़ी खराब हो गई. दिस इज आवर ग्लिनॉइड कैविटी. कोई बात नहीं, चलेगी. ऐसी स्कैपुला भी चलेगी. See, this is our humerus bone now. Okay, चलो ये भी चलेगी, कोई बात नहीं. Humerus bone. ठीक है. Now see here everyone. Now muscle fibers are coming out from here. This is your medial border. And now it is inserting here. Okay. These muscle fibers. This is your which muscle? This is your teres minor muscle. 1 point. Second muscle coming out from here and inserting into the intertubercular groove. Medial lip of the medial lip of where? Intertubercular groove या bicipital groove or medial lip of the floor of the bicipital groove. This is your which muscle? Teres major muscle. Okay. Now one muscle is coming out from here. Okay. These are your muscle fibers. One muscle is coming out from here. From the infraglenoid tubercle. And it is going downward like this. Okay. This muscle. This is your which muscle? This is your long head of triceps muscle. Tricep muscle. Okay. Now see here. It is forming here this quadrangular space. Quadrangular space. Quadrangular space. And this quadrangular space, it is near to the surgical neck of the humerus bone. So two structures are passing from here. What are the two structures? Number one, this nerve is passing. This is your axillary nerve. So axillary nerve is present in the quadrangular space. Second, an artery is passing from here. That is your posterior circumflex humeral artery. Posterior circumflex humeral artery. Okay. So from quadrangular space, axillary nerve is passing and posterior circumflex humeral artery is passing. Now this space, this is your lower triangular space, and it is near to the shaft of the humerus bone. Shaft, this is the shaft of the humerus bone. Lower triangular space. What is passing through lower triangular space? See here, everyone. Number one, the nerve is passing here. What is the name of this nerve? This is your radial nerve. Very important. So in lower triangular space, radial nerve is present. Second, an artery is present. What is the name of that artery? Deep brachial artery. Okay, which artery? Deep brachial artery. Now this upper triangular space, this upper triangular space, this one. This is your upper triangular space. This upper triangular space is having what? It is having your circumflex scapular vessels. Okay. So these are very, very important things which you must have to remember. Clear to everyone? This is clear?